Hi, I'm Rachel Wall with Inspired Hygiene. I want to welcome you to the video today. And I want to give you a couple tips on the things you must do before you or your hygienist ever picks up the periodontal probe. So I'm hearing from a lot of doctors all around the country a couple things right now. One is, I've got open time in my hygiene department. And number two is, all of a sudden, we're realizing that our systems are not in place and that our patients maybe aren't getting the care that they need, and we've really kind of been sweeping this under the rug, and now it's time to open it up and really look at it and develop our periodontal program. So what I tell them is, before you ever pick up the periodontal probe, before you ever start doing an exam, there are two things that you must develop in your practice, okay? One of them is conviction, and the other is calibration. Okay. Conviction is really, if you've listened to any of my other videos or read any of my articles, I talk a lot about the obstacles. What are the obstacles that get in our way of having a really productive, high-service hygiene department? One of them is our mindset, right? And old belief systems. So we must develop a very strong conviction, a very strong set of beliefs about why identifying, diagnosing, and providing treatment for periodontal disease is so important to the overall health of our patients. And if we don't believe this, and if we don't believe that diagnosing and enrolling periodontal treatment at the earliest stages is the best thing for our patients, then it's hard for us to achieve that success in enrollment. Because we must believe it in our heart that it is the right thing for our patients. It must be what we would do for our mother, our brother, our sister, right? So sometimes this takes a little bit of work to develop this, and it's really important that this doesn't just lie with the hygienist or the doctor. It must lie within the whole entire team. So when I work with private clients, this is an exercise that we do. We spend a lot of time on this together, is really developing this very strong why. Why is it time to develop our periodontal program? Why is it time to really take that up a notch? And it has to be more than creating a productive perio department or more than a productive hygiene department. Because the numbers are important. They are a natural byproduct of delivering the best service. But what the numbers are is they are a measuring stick for the amount of value that we're giving to our patients. So it must start with the conviction. It must start with the high level of service. So there are a lot of ways that this can happen. Obviously, attending CE, like our perio webinar series. There's tons of great periodontal CE out there. Reading articles by periodontal experts, looking at periodontal research studies, doing your own search and things like that on the web, looking at resources on perio.org, the AAP's website. There are tons of resources out there to help you develop this. And for me, what I find is really developing and finding out those systemic links from periodontal disease to things like heart attacks, strokes, even certain types of cancer, because that is really the far-reaching effect of our care, right? That's where we really start to step into the place of being a true healthcare professional. And it is our utmost responsibility as dental professionals to our patients to really identify this disease instead of just kind of sweeping it under the rug. It's also, there's a big liability issue here. As doctors, it's important for you to have diagnosed, documented the diagnosis and the recommended treatment for your patients so that you have done your due diligence with your patients and done the right thing for them, and that that's documented in their chart in case it's ever called into question. So we must first develop this really strong conviction together as a team for why you're going to move forward with refining or implementing a new periodontal protocol, okay? The next one is calibration, and this is getting everybody on the same page. I hear this all the time from folks that call me and say, you know what, I've got 3 hygienists and they're all fantastic, and yet they're all doing something different. One of them brings the patient back 2 weeks after perioscaling root planing. One brings them back 2 months afterwards. One uses this language, one uses that language, and we're really missing out on a lot of opportunities, and we've really got to get everybody on the same page. And the beauty is when a patient can visit each hygienist and in their own style and unique ability deliver the same information, perform the same exam, and provide the same care. That is the beautiful sweet spot of this. So that's where calibration comes into place, okay? So here's one tip. Set aside 30 minutes with doctors and one hygienist and do a clinical calibration, all right? And here's what you're going to do. You're going to pull out all of your probes, all right? Take out all of your probes. You're going to compare them, make sure they're all in working order, they're not bent or broken, or all the ink, the paint is scratched off of them so you can't even read the numbers. And then you're going to make sure that you know which marking means which millimeter. I know it sounds basic, but it's so important for you all to do this together, okay? So how are you reading the probe? Okay, do we know when a 4 is a 4 is a 4? Because that may be the threshold that the patient has to cross, and then you're recommending periodontal therapy. So it's important to have that all in place. The next thing is, how are you using the probe? You know, are you using similar, angulation techniques? Are you keeping the probe along the long axis of the tooth? How far are you going into the call space without the probe becoming kind of perpendicular to the tooth? You know, that's an important space to be able to measure, because that's very often where disease starts, is in the call space. So spend some time on that and really get calibrated. What I suggest is having one patient that has some periodontal pockets, and having each of you independently probe that patient and then compare your readings, and then get all back together and really look at what you've come up with and how you can refine that to get closer together. Remember to set this up as a really safe environment, learning environment. There's no right or wrong. This is just an opportunity for everybody to get better. So that's the first step of calibration. The next one, again, is developing, what language are we going to use so that we're all on the same page? What are the key words we're going to use? What tools are we going to use? Are we going to use Casey or our digital x-rays, or how are we going to communicate this to our patients? Are we going to take photographs? What is our protocol? At what point does a patient enter periodontal treatment? And how do we proceed through that treatment? And what is the follow-up? How do we keep them in maintenance? So those are all parts of calibration as you develop your protocol. So before you ever pick up a periodontal probe, it's important that you develop these 2 points: conviction and calibration. If you'd love to learn more and you like what you heard from these videos, I invite you to visit hygieneprofits.com. Thank you so much. I'll see you next time.